Crisis standards of care activated and COVID patients filling up hospital beds across the state. Governor Little is granting Idaho hospitals $10 million in relief funds. Little says this money is meant to address the urgent needs. Our Tristan Lewis breaks down where this money will specifically go. He's at St. Alphonsus tonight. Tristan, is this additional funding to what the state has already provided?
Kim, that's correct. According to the governor's office, since May, they've been able to direct $7 million to Gem State hospitals. $4.5 million are headed towards urgent care and primary care entities, and $8.5 million are going towards skilled nursing facilities. The Idaho Department of Health and Welfare is working to make sure Gem State health systems and entities remain equipped to handle the pressures during crisis standards of care. Just last week, the department announced $1 million was set aside for primary and urgent care facilities, while $4 million was directed towards hospitals.
The demand for those resources has exceeded the amount of funding that we had available. And I am happy to report, as you probably saw in the governor's press release, that we have an additional amount of money that's available.
$10 million to be exact. According to Health and Welfare, that $10 million looks like this. $3 million will go towards hospitals. An additional $3.5 million has been made available for primary care and urgent care facilities. And another $3.5 million is directed towards skilled nursing facilities. The money for the skilled nursing facilities now brings the total to $8.5 million.
It's to support long-term care facilities, specifically skilled nursing facilities, to help take patients that are discharged from the hospitals.
IDHW says 33 hospitals and 16 primary care and urgent care facilities have been awarded funding so far.
Additionally, regarding staffing, we continue to partner with our friends at the Idaho Office of Emergency Management, and we continue to review applications that come in and allocate staffing resources.
257 of the more than 550 requests for personnel across the state have been filled, according to Health and Welfare. These have been filled through the Federal General Service Administration contract and the Idaho National Guard.
Requests for assistance are coming in continuously, and we review those requests on a weekly basis, making those allocations.
The department also has $30 million intended for COVID-19 testing for K-12 schools across the Gem State. And so far, 47 schools and districts have expressed interest in that money, while funding is in progress for 11 of those schools. Kim?
Talking about all this money being spent in this long fight against COVID-19, and a reminder, the vaccine is free for anyone who's eligible to get it.